prognosis and what to expect. In the years since the original production of this video, I've learned some great techniques of soft tissue release. Soft tissue release derives from the European osteopathic tradition and from British sports therapy. It's taught by Stuart Tawes, and I highly recommend the videos and workshops by Stuart Tawes. You can find out about them at softtissuerelease.com. The soft tissue release work works similar to cross-fiber work in breaking up scar tissue, but the soft tissue release will do it throughout the length of the muscle. With chronic stress, with injury, sometimes we can get scar tissue or adhesions on a microscopic level. It's not possible to palpate this, but working the entire length of the muscle, working on it while stretching, can help to release it. Tibialis anterior muscle originates on the front of the tibia and attaches on the medial cuneiform and first metatarsal. It does dorsiflexion and inversion of the foot, and it's often involved in shin splints. To stretch it, we can plantar flex the foot, and to work it with soft tissue release, we plantar flex while working up the muscle. And I like using my knuckles to do this. Now, as I'm doing this, my knuckles move easier as the muscle's stretching, and they tend to stop when the muscle's contracting. This technique can be done passively, where you're doing the work for the client, or you can get the client's involvement in this, where Benny, I'd like you to plantar flex and dorsiflex like this. And then as the client is doing that movement, I am working up the muscle. And again, my knuckles move easier as the muscle's stretching. Doing it actively has some advantages. It can feel deeper, and it's a little more effective because as Benny is plantar flexing, it's through reciprocal inhibition, it's causing the tibialis anterior to relax more. The hamstrings go from the ischial tuberosity up to the tibia and fibula, and they do hip extension and knee flexion. So they'll be stretched like this. And for soft tissue release, we can work stretching the hamstrings while working on them. Again, you can work with knuckles like this. And I always work toward the heart, so going from the knee toward the hip. And this can be done passively where I'm doing the work. Or I can ask Benny now to kick like this. Go ahead. And by reciprocal inhibition, the hamstrings are getting relaxed as I work into it. The piriformis muscle goes from the sacrum to the greater trochanter of the femur, and it does external rotation of the hip. It can be stretched by pushing the knee medially, and we can work into it with knuckles, going from the greater trochanter toward the sacrum, going pretty much straight across like this. Piriformis muscle is involved in sciatic pain, and I showed this technique in the deep tissue massage video as a technique for sciatic pain. Levator scapulae goes from the transverse processes of C1 to C4 down to the upper medial aspect of the scapula, and its action is to raise the scapula. It can be stretched by bending the head to the side. So I cradle Benny's head and I work down the side of her neck with my knuckles like this. Scalene muscles go from the bodies of the cervical vertebrae down to the first and second ribs. The brachial plexus, nerve plexus for the arm, passes through the scalene muscles, and it can get impinged when the scalenes are tight, say after a whiplash accident. A good way to work the scalene muscles is to have the client turn their head toward you, and then with very short fingernails you can hook your fingers over the top edge of the clavicle and then have your client slowly turn their head away. This stretches out the scalenes near where they attach on the first and second ribs while they're being stretched out. It's very important to have short fingernails for this. I also like pulling a little traction on the hand as I do this. Pectoralis major attaches from the clavicle, sternum, and costal cartilages out to the humerus, and it will internally rotate the arm and adduct the arm. It can be stretched by having the client's shoulder at the edge of the table and then bringing the arm back like this. And you can work along the length of the muscle, and you can work this in different planes, working the upper pecs, middle and lower pecs by taking it into different planes of movement. Pectoralis minor goes from ribs 3, 4, and 5 up to the coracoid process of the scapula, and its action is to hunch the shoulder forward. It can be accessed by reaching in under pectoralis major, getting the fingers on the rib cage, and sliding up toward the coracoid process. And then it can be stretched by bringing the arm up overhead like this. So I can actually work the muscle, gliding along the length of the muscle while stretching it. This muscle's involved with thoracic outlet syndrome, so it's a good one to work when clients have pain going down into their arm. For large busted clients, you can have them hold their breast out of the way. That also creates a boundary as you're working. Subscapularis muscle goes from the front of the scapula to the front of the humerus, and it rotates the arm internally. The way we can work this is getting the fingertips along the back wall of the axilla up onto the front of the scapula, and then stretching the arm overhead while pressing into the muscle. This can be a very intense technique, but it can do a lot to release chronic tension in through the shoulder joint. Deltoid muscle attaches from the spine of the scapula and the lateral third of the clavicle down to the deltoid tuberosity of the humerus. Its primary action is abduction. So to work it, we can start with the arm abducted, hook into the deltoid, and slide up the muscle as we bring the arm back down toward the body, like this. This works very well for the middle fibers of the deltoid, stretching them out as we're working on it. And then we can also work anterior fibers of the deltoid by extending the arm while working on it. Biceps brachii muscle attaches from the scapula down to the radius, and its primary action is elbow flexion, but it also does supination of the forearm. To stretch it, what we will want to do is to extend the elbow and to pronate. So we can hook into the biceps while it's relaxed and then stretch it like this while working up the biceps with the knuckles this way. Wrist and finger flexors go from the medial epicondyle of the humerus down into the carpals and out to the phalanges. and they can be involved with carpal tunnel syndrome. They can be stretched out by extending the wrist and fingers, keeping the elbow extended while doing this as well, and working with your knuckles going up toward the medial epicondyle of the humerus. Wrist and finger extensors go from the lateral epicondyle of the humerus down to the wrists and fingers. And they can be stretched by having the client make a light fist and then flexing the wrist while keeping the elbow flexed. And you can work up the extensors. You can work with your thumb, or you can work with the knuckles like this. You can also work pronators and supinators by pronating and supinating the arm while pressing in to the muscles on both sides. You can also do this on yourself as a self-care technique, working on the flexors and extensors. This can be a good preventative for therapists for carpal tunnel syndrome to help prevent that. Stuart Tawes has an excellent video about carpal tunnel syndrome and treatment of it that I highly recommend. The quadriceps muscle group goes from the ilium and the femur down through the patella to the tibia, and its action is hip flexion and knee extension. So a good way to stretch it is to have the client slide to the edge of the table and then bring their foot back under the table. I usually help the client out at first, showing them what I want them to do for the stretch and doing it passively as I'm working up the muscle. And then I can have the client do that action. So I'm able to work the muscle as it's actively being stretched. You can notice that my knuckles move as the muscle's stretching, and the knuckles tend to stop as the muscle's contracting. The adductor muscles go from the ischium and pubis down to the medial aspect of the femur, with the gracilis muscle attaching down on the tibia. They can be stretched like this and working into the muscle with the knuckles like this. The supraspinatus muscle is one of our rotator cuff muscles, and it starts just above the spine of the scapula and attaches to the humerus, and its action is abduction of the humerus. So to stretch it, what we can do is bring the arm back like this, across the back, and we can work into the muscle, working into that area just above the spine of the scapula while stretching it. This can be done passively, or you can have the client reach back as if they're reaching back toward the opposite back pocket as you're working into the muscle. The rhomboid muscles go from the spinous processes of C7 to T5 down to the medial border of the scapula, and their action is to retract the scapula or to draw it back toward the spine. To stretch it, you can drape the client's arm over your arm like this, and then hook your fingers right into the rhomboids, and then taking a step back, you can pull the scapula away from the spine while hooking into the rhomboids. Body mechanics are important with this, and I find this easiest to do in a lunge position, doing like a reverse lunge. So it's my body weight doing the work as I lean back. Now when I come down and out toward the scapula, I'm working the rhomboids, but I can also come up and out and get the lower fibers of the trapezius. Latissimus dorsi originates from T6 down to L5, iliac crest, and the lower four ribs, and it attaches up to the front of the humerus. Its primary action is adduction of the humerus. So to stretch it, we want to maximally abduct the humerus, and the way to do that is to put the client's arm over your arm and then stretch their arm overhead while working down lats like this. The gluteus maximus is the primary hip extensor, so the best way to stretch it is to flex the hip. What I do is put the client's foot on my stomach and then hold their knee, and then I can stretch by taking the knee in a wide arc toward the table and then toward the client's shoulder. And then at the same time, I can be working up the glutes with my knuckles. And if the client doesn't like it, they're in a good position to kick you. The gluteus medius and minimus go from the ilium to the greater trochanter of the femur, and they are abductors of the hip. So the best way to stretch them is to bring the client's leg back behind the table and let it go down below the table while working up the muscles like this. This can be done passively, where I'm lifting, or you can get the client to do the movement actively as you press into the muscles like this. If you want to work minimus a little bit better, you can have the client turn their foot outward as you do this, and that'll work the gluteus minimus. Quadratus lumborum is a very deep muscle in the low back that goes from the iliac crest up to the 12th rib. It also has attachments to the transverse processes of L1 to L4. Its primary action is trunk extension, but it's also involved in side bending. To stretch the quadratus lumborum, we can have the client's arm overhead and their top leg over the back of the table, and then you can raise and lower the leg while working with your knuckles, going from the iliac crest up toward the 12th rib. You can do this for your client, or you can have your client do the movement so that you get the effect of reciprocal inhibition as you're working on this. Psoas and iliacus are deep muscles that flex and externally rotate the femur. The psoas originates on the bodies of the first four lumbar vertebrae, comes down underneath the inguinal ligament, and attaches to the lesser trochanter of the femur. The iliacus originates all along the inner aspect of the ilium and also inserts onto the lesser trochanter of the femur. And both of these muscles will flex the hip, externally rotate the femur. To stretch the psoas, you can have your client's calf resting on your forearm, so you're cradling their knee, and then have their other knee up toward their chest. This flattens the curve in the low back, helps to protect their low back as we're doing this. Then with your fingers, you can press in around the inguinal ligament, contacting the psoas muscle there, and then extend the hip like this. This stretches out the psoas while you're pressing into it. You can also work around the iliac crest, getting the iliacus with this as well. You can also have the client do this as an active movement, but when they do that, I still like to support the leg. Gastrocnemius and soleus are muscles that plantar flex client's ankle. Gastrocnemius attaches on the femur, and the soleus attaches on the back of the tibia and fibula. To stretch the gastrocnemius, you want the knee straight, and you can use your hand on the bottom of the client's foot and then dorsiflex the foot. And I'll use my legs so that I can lunge using good body mechanics. And then work up the gastrocnemius with my knuckles, like this. And I can work up different parts of it. And invert and evert the foot a little bit too, to work it in different planes. If I want to work the soleus, I can bend the knee, get a little deeper dorsiflexion, and be able to work into the soleus like this. The techniques I just showed you are my variations on soft tissue release, and if you'd like